So I get a lot of questions about the difference between ultrasonic and standard rhinoplasty. And essentially the main difference is how I am contouring the bones and what instruments I'm using. So with standard rhinoplasty, the typical instruments are a osteotome with a chisel or a mallet. And those are metal instruments that we use to cut the bone, both to shave the dorsum here and then also to make the bony cuts along the side to bring in the nasal sidewalls so we can make your nose look thinner as well as kind of give it a more tapered appearance, especially for patients that are taking a large hump down, then we have to bring in the sidewalls. So using the osteotome and mallet, though it's a very standard technique, it can be a lot less precise. There can be more variability and it's really hard to get those micromillimeter changes and can sometimes feel rough edges in the bone. So I've converted to using the ultrasonic device, which is powered with water as well, and it really shaves the bone in sub-millimeters in order to really give perfect precision, as well as make the bony cuts much smoother, much more accurate, and ultimately give a much more definitive and more tailored, more tapered result. Additionally, because there's less trauma to the soft tissues with that device versus the standard approach, patients generally have less swelling and less downtime. So it's really ultimately changed my practice and I really love using it. And I think that patients are really satisfied because they ultimately have a very smooth contour of their dorsum and the nasal bones, which ultimately gives them the best results.